name's Kelli Proffer, and I'm doing my comprehensive health assessment, the C350 class. Can you tell me your name?
Dakota Makem.
Okay, and how old are you?
24.
Okay. Okay. Can you tell me what you're here today for?
I'm getting a full body exam.
Yeah. Okay. Is there any other complaints today? Any other issues you'd like to discuss?
No.
Okay. Are you on any medications?
No.
Okay. You allergic to any medications?
No.
Okay. Have you ever had any childhood illnesses?
No.
Okay. Did you ever have chickenpox?
No.
Okay. Ever had any diagnoses as an adult?
No.
Okay. Any surgeries?
No.
Okay. Any psychiatric disorders?
No.
Okay. Can you tell me the date of your last flu vaccine?
About a month ago.
Okay. And your last tetanus shot, do you remember that?
No.
Okay. So you don't know when your last tetanus shot was?
I'm up to date on it.
You're up to date on it? Okay. So it has been less than 10 years?
Yeah.
Okay. Now I'm going to ask you about family history, medical history of your mom. Is she healthy?
Yep.
Has she been diagnosed with anything?
Nope. Healthy.
What about your dad?
Healthy.
Okay. Any siblings?
One brother, one sister.
Okay. Both healthy?
Yep.
Okay. Okay. I'm going to ask you some social and environmental history. No hypertension, no diabetes. Any history of suicide?
Mm-mm.
Alcoholism?
Mm-mm.
Substance abuse?
Mm-mm.
Okay. Where were you born at?
Muskogee, Oklahoma.
Okay. What is your education, your highest education level?
Graduated college at Southeastern Oklahoma State University.
Okay, so you have your bachelor's?
Yep.
Okay. What do you have your bachelor's in?
Health and recreation.
Okay. What's your occupation? What do you do for
Ranch.
Josh? You're a rancher. Cattle?
Yep.
Okay. Are you married?
No.
Single?
Yep.
Okay. Do you have adequate transportation options?
Mm-hmm.
Okay. Do you have health insurance?
Yes.
Okay. Do you live in a neighborhood?
Kind of, sort of.
Kind of. Is it safe?
Oh, yeah.
You can read and write. Do you have access to phones and computers and all that?
Mm-hmm.
Okay. What are your interests and hobbies?
Interest. I like to hunt.
Okay. Anything else?
Fish.
Fish. Okay. And ranch.
Ranch.
Okay. Now I'm going to ask you review of systems. Just let me know if you have any of these complaints. Any weight changes? Weakness? Fatigue? Fevers? Okay. We're going to talk about your skin. Any rash? Lumps, sores, itching, dryness, color change, change in hair or nails? Okay. Talk about your head. Any headaches? History of head injury?
Nope.
Dizziness?
Nope.
Okay. Eyes? Any vision changes? Nope. Do you wear lenses?
Nope.
Do you know when your last eye exam was?
Yeah, it was about a year ago.
Okay, so 2017?
Yep.
Okay. Any pain, redness in your eyes?
No.
Excessive tearing, double vision?
Nope.
Blurred vision?
Nope.
Okay. Any hearing changes?
No.
Any tinnitus, ringing in your ears?
Nope.
Earaches?
Nope.
Discharge?
Nope.
Okay. History of ear infections?
Nope.
Okay. Any nasal congestion? Discharge? Hay fever? Any nosebleeds?
Nope.
Okay. Bleeding gums?
No.
When was your last dental exam?
About a year ago.
Okay. Any sore tongue, dry mouth, sore throat, hoarse? Okay.
Nope.
We're going to talk about your neck. Any swollen glands or lymph nodes?
No.
Any pain, neck stiffness?
No.
Okay. We're going to talk about your breast. Any lumps, pain, discomfort, or nipple discharge?
Not
Okay.
today.
Pulmonary. Any cough?
No.
Okay. Shortness of breath?
No.
Wheezing?
Nope.
No pain?
Nope.
Chest pain, palpitations, like your heart's fluttering or anything?
Mm-mm.
Shortness of breath?
Nope.
Any edema in your legs?
Nope.
Okay. Any appetite changes?
Nope.
Nausea?
No.
Difficulty swallowing?
No.
Okay. Heartburn?
No.
Change in bowel habits?
No.
Have any blood in your feces?
No.
Okay. Any hemorrhoids?
No.
Constipation?
No.
Diarrhea, food intolerance?
No.
Okay. Do you have any burning with urination?
No.
Okay. Any blood in your urine?
No.
Okay. Incontinence?
No.
Okay. You have any hesitancy or dribbling?
No.
Okay. Now we're going to talk about your sexual habits. So, you don't want to use birth control. Ever been exposed to HIV?
No.
No. Any concerns in your interest or function?
No.
No. Okay. Do you have any discharge or sores from your penis?
No.
Okay. Any testicular pain or masses?
No.
Okay. Any pain in your legs, leg cramps, varicose veins, history of blood clots?
No.
Okay. Any joint stiffness, muscle or joint pain?
No.
Any syncope where you're about to pass out or anything like that? Seizures, history of weakness, paralysis, numbness, tingling in the extremities?
No.
Tremors?
No.
Involuntary movements? Okay.
None.
Do you have a history of anemia?
No.
Okay. Do you easily bruise?
No.
Or bleed? Okay. Have you ever had blood transfusions?
No.
Okay. Do you have any heat or cold intolerance?
No.
Okay. Excessive sweating?
No.
Okay. Excessive urination or excessive thirst drinking?
No.
Okay. All right. Any nervousness or anxiety?
No.
Depression?
No.
Memory changes?
No.
Okay. And I've already asked you about the suicide attempts. Okay. All right. Now we're going to go to your vital signs. How much do you weigh?
170.
How tall are you?
5'10".
Okay. All right. I'm going to check your rate and rhythm of your pulse. Let me see your wrist. And I'm going to check the radial pulse for 30 seconds and times by 2, and then the other 30 seconds I'm going to count respirations. Okay, respiratory rate is even and unlabored, it's 20. And then your radial pulse was 65 for rate, and rhythm was regular. Okay, I'm going to take the blood. You have any pain? No? Okay. I'm going to take your blood pressure. If I would have had a blood pressure cuff, just put it up here. And what you normally do is I would place my stethoscope. I'll pretend like I'll do it. Place my stethoscope right here and listen to the brachial pulse. And what I would do is pump it up and then let it out. And whenever you hear the first beat, that would be your systolic. And then the last beat you hear is your diastolic. And that would be your blood pressure. Normal is 120/80. So, do you know what your last blood pressure reading was?
About 120/80 is pretty good.
Okay. Alright. Alright, now I'm going to inspect your skin. First, I'm going to start with your hands and nails. And what we're looking for is pigmentation. I'm going to palpate around and see if there's any knots or nodules, any pain anywhere. Check the capillary refill. You want it to be less than 3 seconds, which it is. It's normal. Any pain? Okay. So then we assess the upper arms. Let me take that off of you. Assess the upper arms and extremities for color, pigmentation, temperature, moisture, and texture, which you're warm, smooth texture. Temperature's good. And I would look at hair distribution as well to make sure it's even. I'm going to take off your socks because I'll have to see your feet in a second.
You want me to take them off?
Yeah, if you want to. Do you have any lesions you're concerned about? Okay. Now I'm going to check skin turgor, and it should go back to its original state pretty quick, so no tinning, so that's good. That's normal. Okay, now we're going to move on to your head and face. I'm first going to feel around your scalp. I'm going to palpate for any tenderness, lesions, lumps, swollen lymph nodes, assessing the hair distribution, making sure it's even, and making sure the cranium's normal, which it is. It's normal cephalic. Okay, now we're going to do cranial nerve 7. This is a facial nerve, so I want you to raise your eyebrows. I want you to smile real big. Puff your cheeks out. Okay, and show me your teeth. Okay, and close your eyes real tight. Okay, everything's normal. That's cranial nerve 7. I'm going to feel now of your temporal artery and the temporal mandibular joint, and it's just palpation. Temporal ribs good. All right. I want you to open and close your mouth. Any pain? Okay. Temporomandibular joint's good. Now I'm going to palpate from your maxillary and frontal sinuses. Let me know if you have any pain. Any pain? No? Okay, that was a frontal. I'll do the maxillary now. Any pain? No? Okay. Things normal. Now we're going to do your eyes. I'm going to start with the cranial nerve 2. What I'm going to do is wiggle my fingers and tell me when you can first see my fingers, but keep looking at me. Okay. All right.
See.
Okay.
See. See.
Okay. Cranial nerve 2 is intact. Now we're going to do cranial nerve 3, 4, and 6. We're going to do cardinal positions of gaze, which is going to look at your extraocular muscles. So I want you to look at my finger and follow my finger. Okay, extraocular muscles are intact. I didn't see any nystagmus or strabismus or anything like that. Next, we're going to do the corneal light reflex. All I want you to do is just look at this light. And what I'm looking for is the light reflex the same in both corneas, which it is. Okay. And now I'm going to go ahead and check your pupils, your pupillary reaction and a consensual reflex. Okay. Yeah, just keep looking straight. Okay. Okay, pupils are round, reactive to light, and a consensual reflex is noted. Okay, now I'm just going to look at your external structures. I'm going to look at your conjunctiva, your sclera, and your corneas and stuff. No pain. Okay. Conjunctiva is pink, sclera is white with no jaundice noted. Even distribution of eyelids and eyebrows. So the external structures look good. Okay, now we're going to do your ears. I'm just going to palpate your ears and let me know if there's any tenderness. Any tenderness or anything? No? Okay. Now I'm going to perform a whisper test. So I'm going to have you hold, the right ear. I'm not going to have you look at me. I'm going to repeat 3 letters, and I want you to repeat them back to me.
Okay.
R-U-K.
R-U-K?
Yep. All right. Include the other ear. Y-U-T.
Y-U-T?
Yep. Okay. So cranial nerve 8 is intact. Now I'm just going to look at your nose. I'm going to look at the asymmetry of your nose and check the patency of your nostrils. So I'm going to have you tilt your head up a little bit and we'll look at your septum. Make sure it's midline. Just like, okay. Septum's midline, no deviation. Take a deep breath. Okay. No problems breathing. Patency of nostrils is noted. Okay, now I'm going to look at your mouth and throat. I'm going to have to use that. First, we're going to look at your lips and the buccal mucosa. Lips look good. I don't see any lesions, no sores or anything like that. Open your mouth for me. I'm just going to close it just a little bit. Yeah, relax it. Yeah. Just looking at your vehicle mucosa. A lot. Okay, it's pink. I don't see any lesions or your dentition is good. Teeth look good. Okay. Pink and moist. Okay. We are going to look at, I'm going to do the cranial nerve 10 now. I'm going to have you say all for me. I'm going to look at your uvula while you do it. I'm going to look at the hard palate and the soft palate as well while you do it, and your tonsils, okay? Stick your tongue out. Okay, say ah.
Ah.
Okay. All right. Say it one more time.
Ah.
Okay. Uvula's good. It ascends while you say ah, which is good. Tonsils look good. They don't look swollen. Now I'm going to do a gag reflex, cranial nerve 9, so I'm going to make you gag, okay? Open your mouth. Okay. All right. Cranial nerve 9 is intact. All right, stick your tongue out for me. Straight out. Okay. All right, cranial nerve 12 is normal, no deviation of the tongue. All right. All right, now we're going to do your neck. First, I'm going to inspect the symmetry of it, just a little bit, and look for any pulsations or lumps or anything like that. And then I would palpate any tenderness. I'm going to palpate for the cervical lymph nodes. Any pain? Okay. I don't feel any lymph nodes. Now I'm going to feel your carotid. Good upstroke of the carotid. I'm going to listen for any bruise. Okay, no bruise noted. All right, now I'm going to look at your trachea. I'm going to palpate your trachea. I'm going to have you swallow here in a second. Okay, swallow for me. Okay. Trachea is good. I want to feel your thyroid gland too as well. Palpate it. Okay, swallow. Okay, thyroid gland's good. No nodules noted or anything like that on it. And then we're going to do cranial nerve 11 now. So I'm going to have you shrug your shoulders against resistance. Shrug them. Okay. Turn your head to the left. That way.
Oh. Against
resistance. Okay. And, okay. Good. Okay, now we're going to look at your thoracic cage. I'm going to start posteriorly, so I'm going to have you set over here, kind of with your back.
Here?
Yeah. Yeah. Okay. Or actually, yeah, sorry. Scoop. Yeah, if you can set, there you go. Okay. So first we're going to look at the skin characteristics, look at symmetry, noting any lesions, any petechiae or anything like that. I'm going to palpate around for any tenderness or lumps. Any tenderness? Okay. All right. Okay, now I'm going to have you stand up for me, sorry. Okay. Now I'm going to check for symmetric expansion. Okay. Take a deep breath. Okay. That's good. It's even. I'm going to check for CVA tenderness. Just let me know if this hurts.
Nope.
Okay. I'm going to feel your spinous processes. This is your C7 and T1. Is there any pain? Nope. Okay. All right, we're going to do tactile firmitus. I just want you to repeat 99 for me, okay? Say 99.
99. 99. 99. 99. 99.
Okay. Looks good. I'm going to percuss your lung fields. And we're listening for hyperresonance. Resonance. Okay. And now I'm going to listen to your breath sounds. Deep breath. Okay, looks good. Now I'll have you, breath sounds were clear, no adventitious sounds noted. You can come back here and sit on the front of the bed now. Okay, now I'm going to inspect your anterior chest. And same thing here, I'm just looking for any petechii, any lumps, anything like that. I'm going to palpate. Okay. Alright, and I'm going to do the tactile fremitus again, so I'll have you repeat the 99. I'm trying to look. Okay. Say 99.
99, 99, 99, 99, 99.
Okay. Okay, we're going to percuss your lung fields again. Sorry. Okay. Resonance sounds good. And I'm going to listen to you. One more deep breath. And one more. Okay, they're clear. No crackles or wheezes noted. Okay, now I'm going to assess your heart. First, we would just inspect the precordium for any heaves or pulsations noted, which I don't see any. And then next we're going to palpate for any thrills. So I'll start on the right sternal border. You can just breathe normal. Okay, I'm going to have you lay down back here to check your apical pulse and stuff and to listen to you really good.
Right here?
Mm-hmm. Okay. Anyways, I didn't feel any thrills. I'm going to palpate for your apical impulse now. Okay. Rhythm's normal. Alright, I'm going to auscultate your heart sounds, okay? Okay, listen to your apical pulse. Okay, apical pulse is regular. Didn't S1 and S2 was noted. Didn't hear any other sounds. No murmurs. No S3s or anything like that. Now we will go to your upper extremity, so I do want you to stand up for this one, or you can sit on the side of the bed, it'll be fine. Yep, sit on the side of the bed. Okay, first we're going to start with range of motion of your arms. So first I want you to raise your arms out in front of you and above your head, which is which will be our flexion, and then put them behind your back, extend your shoulders, okay? And then, okay, we're going to do abduction out, okay? And then adduction back in, okay? Sounds good. Hands out in front, okay? Do supination, and pronation, okay? And then, you put your hands down now. And then I want you to do internal rotation and external rotation. Okay. Now I want you to do elbows, flex, extend. Okay. Let me see your wrists. Do that. Flex, extend your wrist. Okay. Fingers. Put your fingers up. Okay. Adduction, abduction. Okay. Let me check your strength now. So what I want you to do is grab my fingers as hard as you can. Okay. Put your arms like this. Don't let me pull them down. Okay. And resist me. I'm trying to pull them up. Okay. All right. And go ahead and put your arms straight out and try to push them down. Okay. Strength is good. And now I'm going to look at your palpate for epitrochlear nodes. So I'm just see your arm and bend it a little bit. No pain. Okay. No enlarged lymph nodes. Okay. Now, we will have you lay back down. We're going to look at your, have your head tilt that way. I'm looking for the jugular venous pressure and pulse is what I'm looking for. I'm looking for the pulsation here and if the neck vessel is distended, which could indicate right-sided heart failure. So, I see the pulsation right here, but there's no distension of the vessel at all, so his JVP is normal. Like I said, I don't see any distension. Okay, we will do your abdomen now. So first, I'm going to just assess the abdomen, look at the color, if there's any scars, striae, or anything like that. Mainly look for hernias, especially around the umbilical area. I don't see anything. Your abdomen looks good, so I'm going to listen to your bowel sounds now. I'll listen to all 4 quadrants, and then I'm going to auscultate your arteries as well. So, sounds in all 4 quadrants. It's good. I'm going to listen to your aorta. And mainly what I'm looking for on this is any bruise. Listen to your renal arteries. Your iliac. Okay, and I'm going to listen to your femoral now, okay? Okay, I didn't hear any bruise in any of your arteries. Bowel sounds are good. They were noted in all 4 quadrants. So now I'm just going to lightly percuss, just feel around, lightly percuss in your abdomen in all 4 quadrants. Okay, sounds good. I'm going to do your liver span now, so I'm going to percuss up to dullness and then percuss down at the midclavicular line to dullness. So. Everything's normal. I am going to palpate your liver now, okay? I'm going to have you take a deep breath here in just a second. Let me put your head down a little bit. Okay. I'm going to kind of wrap my hands around your ribcage. Okay, take a deep breath. Okay, let it out. Okay. Now I'm going to percuss for your spleen and then I'll palpate for it, okay? I'm going to palpate for your spleen. Okay. Deep breath. Okay. All right, and I'm going to palpate for your kidneys now. Deep breath. No pain or tenderness while I'm palpating? Okay. Okay. All right. No tenderness, no pain. I didn't feel any nodules or any abnormalities. All right. And I'm going to just palpate your aorta. Mainly for the sides of it. Feel if there's any... No pain or anything. Okay. All right. I'm going to assess your inguinal area now. I'm going to feel of your femoral pulse and your inguinal lymph nodes, okay? Okay. No tenderness. Okay. No tenderness? Okay. All right. Now I'm going to look at your lower extremities. Okay. Here I'm pretty much assessing the same thing. It's symmetry, skin characteristics, any lesions, any scars, any nodules noted, hair distribution is a main thing, any swelling in the calves, which could indicate a blood clot. Temperature's good, hair distribution's normal, and it's the same. Skin temperature on each side's the same. Everything looks symmetric, no pain or anything. Okay. Okay, now I'm going to check your popliteal pulse, so I'm going to have you just, and this side. Okay, and then we're going to check your posterior tibial. Okay, and dorsalis pedis. Okay. Okay. No edema. I'm going to look at your toes real quick, okay? Check cap refill. Less than 3 seconds in both. No lesions, no scars, no pain or anything like that. Okay. Okay, we're going to do range of motion and muscle strength now. We're looking at your, we're going to be doing your hips and your knees and your ankles. First, we'll start with your ankles. I want you to dorsiflex your ankles and bring them back. Okay, and plantar flex, bring them forward. Okay. And then on your hip, I want you to abduct, which is bringing it out. Okay. And then adduct back in. Same way over here, which I can help you. Okay. Okay. Then on your knees, I want you to just bring it up. Flex your knee. Okay. And extend. Okay. Flex your knee. Extend. And flex your hip. Yeah, bring your foot up. Okay. Your other foot up. Okay. I'm going to check for internal and external rotation of your hip. No pain, crepitus, anything like that in any of your joints? Okay. Okay. That's good. I'm going to check your strength. I want you to pull your feet up against resistance. Okay. And push. Okay. And try to lift your legs. Okay, strength is good. If you want to, while you're still laying down, we can do your, let's do the cerebellar function, and you're going to take the opposite heel right here and run from your knee down to your toe and do both sides, okay? And opposite side. Okay. That's good. Mark off what I've done. Okay. I'm going to do a position sense on you. I need you to close your eyes. And I want you to tell me if your big toe is going up or down.
Down.
Okay. It's normal. Okay, I'm going to do stereogenosis on you now. Keep your eyes closed. I'm going to hand you an object, and I want you to tell me what it is. This is your hand.
Ink pen.
Yep. Okay. Stereogenosis is normal. Okay, I'm going to check your Babinski reflex. You can open your eyes now. I'm going to check your Babinski reflex, and then we'll have you set up on the side of the bed, okay? Okay. Babinski reflex noted. Actually, I'll go ahead and do your deep tendon reflexes while you're laying down. And normally I would have a correct instrument to do this with, but I don't. So first, let's test your, we'll go ahead and have you sit up. Yeah, go ahead and sit up. Yeah, you go ahead and sit down here. You're fine. Okay, first we're going to check your, triceps. Okay, then we'll check your biceps. Okay. Do your triceps on this side. Okay, and then your biceps on this side. Okay, and then we're going to check the brachioradialis reflex as well. Actually, felt a response on that one. Okay, check your patellar reflex. Yeah, just relax. Okay. Okay, and Achilles. I don't know. They'll not be able to see me. Okay. Yeah. Here, you can just cross your leg. Okay. Okay. All right. All your reflexes were 2+. They were normal. Okay. I want you to close your eyes, and I'm going to have you close your eyes and just touch your finger to your nose. Okay. I'm doing a neurological exam on you now. Okay, that's good. You can open your eyes. Touch your fingers to your thumb as fast as you can. Okay. Okay. And put your hands on your lap and alternate palms. There you go. Okay. All right, I'm going to assess the sensation of your face now. And I will be assessing the cranial nerve number 5, the trigeminal nerve 2 whenever I do this. So what I'm going to do is have you close your eyes. This is what I'm using. You either tell me if it's sharp or soft, okay?
Sharp. Soft. Soft. Sharp. Soft. Soft.
Okay.
Sharp. Sharp. Soft. Sharp. Soft. Sharp.
Okay. So that's, yeah.
Soft. Sharp. 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 Soft. Sharp.
Okay. I'm going to do your legs. Okay.
Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft.
Okay. Your sensation's good. It's normal. Okay. All right. Now I'm going to have you. I'm going to test the musculoskeletal. Go ahead and stand up for me. Okay. I want you to. Hey, you look at me. I want you to just walk across the room, heel to toe.
This way?
Yeah. Yep. Okay. You can turn back around. All right. Just walk normal. Now I want you to walk on your tiptoes first and then turn around and walk on your heels, coming back. Okay, walk on your heels. Okay, looks good. All right, now we're going to do the Romberg sign. What that is, put your feet together, hands at your side, and look at me, and just close your eyes. So I'm going to watch you for about 30 seconds. is normal. Now we need to do this shallow knee bend. So what I'm going to have you do is you'll kind of squat down on one leg for just a little bit, and then the other leg. Okay, you can do the other leg. Okay. All right, good gait, good stability. All right, now we're going to look at the range of motion of your spine. So first of all, I want you to turn around. I'm going to turn around right there. Yep. I'm going to palpate his spine for any tenderness, lumps, or lesions. Any tenderness? Okay. All right. Now I want you to touch your toes. This is going to be, you're going to flex your spine. And at this time would be a great time to look at your spine and see if there's any curvature, any scoliosis or anything like that. Your spine looks normal. I want you to extend your back by bending back as far as you can. Okay. I want you to do lateral flexion, bend it side to side. Okay. And can you rotate at your waist? Okay. All right. Everything looks normal. Okay. That ends the physical assessment part. So now I'll ask you about your social determinants. Can you tell me about your job?
I feed cows in the morning and tend to what needs to be tended to in the afternoon.
Okay. So, are you outside a lot in the sun and all that?
All day.
Okay. Okay. Do you have to, well, I mean, if you're at home, you don't really have to travel that far for employment, but do you haul cows?
Occasionally.
Occasionally? Okay. How far do you have to go for that?
Oh, it just depends. Normally it's about anywhere from 20 to 100 miles.
Okay. Okay. Can you describe to me your housing situation? Do you have adequate housing?
Yep.
Okay. Do you own your house?
Yep.
Okay. Do you have a mortgage?
Nope.
Okay. Okay. What's that? Well, I asked you this earlier, but what's the highest level of education? You told me you had a bachelor's.
Yes, ma'am.
Okay. What's your degree in?
Health and sports and recreation.
That's right. Okay. All right. Tell me about your support system. Do you have an adequate support system?
Mm-hmm.
Okay. Who is all your support system?
My mom, my dad, brother,
Okay.
and sister.
Do they live close?
Yeah, fairly.
Okay. Do you live in a rural or urban community?
Urban.
Okay. Okay. Describe to me your access to healthcare and pharmacies. Do you have adequate access to healthcare?
Yeah.
Okay. So, kind of describe to me what kind of facilities are close to you. Do you have access to primary care, to emergent care, critical care? Do you have access to all of that?
Yeah.
Okay. About how far do you think you'd have to go?
Oh, about 10 miles.
Okay. Okay. Access to dental?
Yeah.
Okay. What about eye care?
Yes.
Okay. Do you have health insurance?
Yes.
Are you able to afford your copays and out-of-pocket expenses?
Yes.
Okay. Describe to me the options available in your community for health and nutritious foods.
There's a couple grocery stores.
Okay. Do they have good? They have grocery stores with good produce and stuff.
Yeah.
Okay. About how far are they for you?
About 10 miles.
Okay. Do you cook?
Yes.
Okay. Okay, can you describe to me any environmental conditions you may be concerned about in your community, whether it's pollution, your water supply? Nothing?
No.
Okay. Is your community pretty safe to live in?
No.
Any a high crime rate or anything?
No, not really.
Okay. Well, that concludes the exam. I just encourage you to follow up with dental and see your PCP for any other concerns.
All
All
right.
right. Thank you.